आज हम कर रहे हैं 120 MCQs नर्सिंग। ये फार्मासिस्ट के भी काम आते हैं और नर्सेस के भी काम आते हैं। क्वेश्चन नंबर 1 है, विच ऑफ द फॉलोइंग इज कंसिडर्ड द मास्टर ग्लैंड ऑफ द एंडोक्राइन सिस्टम? थायराइड ग्लैंड, एड्रेनल ग्लैंड, पिट्यूटरी ग्लैंड और पेनक्रियाज? द आंसर इज पिट्यूटरी ग्लैंड. Next, what is the normal range for an adult's resting heart rate? Answer है इसका 60 to 100 beats per minute. Question number 3 है, which vitamin is essential for blood clotting? Answer है इसका विटामिन के. Question number 4, when administering an intramuscular IM injection, at what angle should the needle be inserted? It is 90 degree. Question number 5, which blood type is known as the universal donor? O negative. What is the primary purpose of the nursing process? To provide a systematic method for delivering patient care. Next question है, a patient with a respiratory rate of 8 breaths per minute is experiencing bradypnea. Which organ is primarily responsible for the detoxification of drugs in the human body? Liver. What is the priority nursing action when a patient experiences a transfusion reaction? Stop the infusion immediately. In CPR, what is the recommended ratio of chest compressions to breaths for an adult? 30:2. 15:2 is for kids, infant. Next question, which electrolyte imbalance is most closely associated with a positive Troussias sign? Hypocalcemia. The 5 rights of medication administration include right patient, right drug, right dose, right route, and right time. What is the preferred site for an IM injection in infants? Vastus lateralis. A patient with a blood pressure of 145/95 mmHg is classified as having hypertension. Which position is most appropriate for a patient experiencing shortness of breath? Fowler's position. What is the antidote for heparin overdose? Protamine sulfate. Which heart chamber pumps oxygenated blood into the aorta? Left ventricle. What type of precaution is required for a patient with active tuberculosis? Airborne precautions. Subjective data in a nursing assessment refers to what the patient says. What is the first sign of a pressure ulcer? Non-balanceable erythema. What is the normal range for blood pH in a healthy human? 7.35 to 7.45. Which of the following is the most accurate method to confirm the placement of nasogastric NG tube? X-ray. A patient is prescribed furosemide Lasix. Which electrolyte should the nurse monitor most closely? Potassium. What does the A stand for in the ABC of emergency life support? Airway. Anuria is defined as a 24-hour urine output of less than 100 ml. Which cranial nerve is responsible for the sense of smell? Olfactory. When performing a physical assessment, which technique is usually performed last for the abdomen? Palpation. Which insulin is considered rapid acting? Lispro. Humalog. The removal of a piece of tissue for microscopic examination is called biopsy. Which term refers to a heart rate greater than 100 beats per minute? Tachycardia. Which of the following is the primary pacemaker of the heart? SA node. A patient with orthopnea experiences difficulty breathing while lying flat. What is the standard duration for a nurse to perform a surgical hand scrub? 2 to 6 minutes. Which of these is a classic symptom of hypoglycemia? Diaphoresis, that is sweating. The G in the APGAR score for a newborn stands for grimace. Which medical term describes the surgical removal of the gallbladder? Cholecystectomy. What is the main function of the large intestine? Absorption of water and electrolytes. Which position should a patient be placed in for a lumbar puncture? Lateral recumbent fetal position. A stoma that is dark blue or purple in color indicates ischemia. What is the primary purpose of wearing a mask during a sterile procedure? To prevent the spread of droplets from the nurse's mouth or nose to the sterile field. What is the most common side effect of opioid analgesics like morphine? Constipation. Which of the following is an objective sign of pain? Increased heart rate and blood pressure. In the rule of nines for burn victims, the entire anterior front trunk accounts for 18%. Which lung sound is high pitched and musical, often heard in patients with asthma? It is asthma. Wheezing. The universal recipient for blood transfusions is AB positive. Which of these is a priority nursing diagnosis for a patient with a fresh hip fracture? Acute pain. What is the primary reason for using a Z-track method during an IM injection? To prevent the medication from leakage into subcutaneous tissue. Which hormone is primarily responsible for lowering blood glucose levels? Insulin. Hematuria refers to the presence of what in the urine? Blood. When performing chest compressions on an adult, what is the recommended depth? at least 2 inches. Which position is most appropriate for a patient receiving a large volume cleansing enema? Left sims. The term dysphagia refers to difficulty in swallowing. When a patient is on warfarin comedin therapy, which lab value is monitored to adjust the dose? INR PT. What is the minimum urine output per hour that indicates adequate kidney perfusion in an adult? 30 ml per hour. Which of the following is the most significant risk factor for developing a pulmonary embolism? Deep vein thrombosis, DVT. The golden hour in trauma nursing refers to the first hour after a traumatic injury where medical intervention is most effective. Which electrolyte is the primary extracellular cation? Sodium. Auscultation is the process of listening to sounds produced within the body.
Good morning. क्या कर दिया आपने आज?
What is the priority nursing action for a patient experiencing a grand mal seizure? Protect the patient from injury and maintain a clear airway. Which type of insulin can be administered intravenously? IV. Regular. Which of the following is the most common cause of iron deficiency anemia? Chronic blood loss. When assessing a patient's pupils using a pen light, accommodation refers to constriction when focusing on a near object. Which part of the brain is responsible for balance and coordination? Cerebellum. What is the standard concentration of oxygen in room air? 21%. A patient with pitting edema in the lower extremities likely has an imbalance of fluid and electrolytes. Which type of burn is characterized by blisters and intense pain? Second degree burn, that is partial thickness. What is the therapeutic range for a digoxin level? 0.5 to 2.0 Ng per ml. Before administering digoxin, the nurse must check the apical pulse for 1 full minute and withhold the dose if the heart rate is less than 60 beats per minute. In a psychiatric setting, the term hallucination refers to a sensory perception without an external stimulus. Which vitamin is also known as ascorbic acid? Vitamin C. What is the primary clinical manifestation of right-sided heart failure? Peripheral edema, swelling in legs. Which position should a patient be placed in to prevent aspiration during tube feeding? Semi-Fowler's, that is 30 to 45 degrees. The window of time to administer thrombolytic therapy, clot busters, for an ischemic stroke is generally within 3 to 4.5 hours. Which electrolyte is the most dangerous to have in excess? Hyperkalemia, due to its effect on the heart. Potassium. What is the medical term for a nosebleed? Epistaxis. When using a cane, on which side should the patient hold it? The unaffected strong side. Which of the following is a sign of pyloric stenosis in an infant? Projectile vomiting. What is the purpose of a low sodium diet in a patient with hypertension? To reduce fluid retention and blood volume. A patient is diagnosed with cystitis. Which organ is inflamed? Bladder. In medical terminology, the suffix itis refers to inflammation. Which hormone is known as the fight or flight hormone? Epinephrine, adrenaline. What is the priority nursing intervention for a patient with a suspected neck injury? Immobilize the cervical spine. Which of the following is a classic sign of glaucoma? Loss of peripheral vision, that is tunnel vision. The medical term aphasia refers to an impairment in language or communication. Which type of isolation precaution is used for a patient with MRSA in a wound? Contact precaution. When a patient is in shock, what usually happens to their vital signs? BP decreases, pulse increases. Which of the following foods should a patient on a clear liquid diet avoid? Orange juice with pulp. What is the primary function of platelets? blood clotting. A patient is NPO before surgery. This means nothing by mouth. Which of the following is a sign of toxicity in a patient taking lithium? Severe tremors and diarrhea. Which organ in the human body is responsible for producing bile? Liver. What is the most effective way to prevent the spread of healthcare associated infections? Consistent hand hygiene. A patient with a pulse oximetry SpO2 reading of 82% is experiencing hypoxia. Which of the following is a landmark for locating the apical pulse? Fifth intercostal space, left mid-clavicular line. Bradycardia is defined as a heart rate below 60 beats per minute. Which position is used for a patient in shock to improve blood flow to the brain? Trendelenburg or modified Trendelenburg. What is the main objective of triage in an emergency department? To prioritize patients based on the severity of their condition. Which vitamin deficiency is the most common cause of rickets in children? Vitamin D. In the nursing acronym SBAR, what does the R stand for? Recommendation. What type of needle gauge is typically used for a blood transfusion to prevent hemolysis? 18 gauge. Which electrolyte is primarily responsible for maintaining osmotic pressure and fluid balance in the extracellular fluid? Sodium. A patient with jaundice, yellowing of the skin or sclera likely has an accumulation of bilirubin. Which medication is commonly used as a rescue inhaler during an acute asthma attack? Albuterol. What is the normal range for a fasting blood glucose level? 70 to 100 mg per dl. The term paresthesia refers to numbness or tingling, that is pins and needles. Which vital sign is the most sensitive indicator of early neurological deterioration? Level of consciousness, LOC. Which of the following is a symptom of left-sided heart failure? Dyspnea and pulmonary crackles. When a patient is receiving a total parenteral nutrition TPN infusion, which lab value must be checked every 6 hours? Blood glucose. What is the primary reason for applying cold packs to a fresh injury within the first 24 hours? To cause vasoconstriction and reduce swelling. A patient is diagnosed with phlebitis. This means there is inflammation of a vein. Which nursing action is vital before administering an internal feeding through a gastrostomy tube? Checking for residual volume. The term oliguria is defined as a urine output of less than 400 ml per day. Which of the following is the most common sign of digoxin toxicity? Visual disturbances, yellow-green halos. Hypovolemic shock is primarily caused by massive loss of blood or fluids. Which position is used for a female patient during a urinary catheterization? Dorsal recumbent. A black tarry stool, melena, usually indicates bleeding in the upper GI tract, that is stomach or esophagus. Which heart valve is located between the left atrium and left ventricle? Mitral, that is bicuspid valve. What is the priority nursing action for a patient with evisceration, organs protruding from a wound? Cover the area with sterile saline soaked dressing. A positive Mantoux PPD test indicates the patient has been exposed to TB. This is exposure to TB and has developed antibodies. Which organ is responsible for the production of insulin? Pancreas. थैंक यू। ये है आपके 120 MCQs नर्सिंग MCQs। आप मुझे कमेंट्स में बताएं कि आपको और कौन से टॉपिक पे आपको MCQs चाहिए, तो आप प्लीज़ कमेंट्स में मेंशन करें। थैंक यू।